Bismillah ar-Rahman ar-Rahim. Invasive cervical resorption, distribution, potential predisposing factor, and clinical feature. This paper was published in JOE in 2020. It is a retrospective study. The main author is Yuan et al. In general, according to the header say in 1990, invasive cervical resorption is localized resorption originating from external cervix root surface, and the prevalence of invasive cervical resorption ranging from 0.2% to 0.8%. So cases with prior internal bleaching have only low percentage of total invasive cervical resorption. And the etiology of invasive cervical resorption unclear, and it is multifactorial problem. It has been proposed to be related to the developmental defect in the cemento-enamel junction. So dental trauma, internal bleaching, orthodontic treatment, and other surgical procedures are often related to the invasive cervical resorption. Invasive cervical resorption at the early stage initiates below the epithelial attachment and has no visual sign. And in the later stage of invasive cervical resorption, when the tooth was destruction, structure become apparent. And the maxillary anterior teeth were most commonly affected according to the Mavrido in 2017. Moving to the objective, this study has two objectives. The first objective was to assess the distribution and potential predisposing factor of invasive cervical resorption. The second objective was to investigate the clinical feature of invasive cervical resorption. Moving to the methodology, in this study, patients over 10 years of age who were diagnosed with invasive cervical resorption. The affected tooth was required to have radiography taken to confirm the location and size of the lesion. All collected cases were screened by 3 endodontist observers. The data of the patient includes sex, age, at which invasive cervical resorption was initially diagnosed, position of the affected teeth, and case type. A patient with single invasive cervical resorption affected tooth was classified as single invasive cervical resorption case, whereas patient with more than one invasive cervical resorption affected tooth was classified as multiple invasive cervical resorption case. Relevant systemic disease, history of dental trauma, orthodontic treatment before discovery of an invasive cervical region using radiographic image. Regarding to the clinical parameter, including percussion, periodontal propping depth, bulb vitality, and sinus tract tracing were recorded, and the presence of periapical lesion and combination with other type of resorption was also noted. Then the Fisher test was used to compare the clinical feature between lesions. So the finding of this study was 67 teeth were diagnosed as begin affected by invasive cervical resorption. 4 teeth were excluded. The remainder of 63 invasive cervical resorption teeth from 31 patients divided between 14 men and 17 women were found, with an average age of patient 45 years. Also, more female patients were found in single of invasive cervical resorption, which was 61%, whereas more male patients were found in multiple invasive cervical resorption, which was 80%. However, there is no significant difference was found between the case type and patient sex. The most commonly affected maxillary anterior teeth, which is 47%, followed by maxillary premolar. Regarding to the predisposing factor of invasive cervical resorption were divided into two groups, a systemic condition and dental-related factor. Most patients denied all major systemic disease, and the most common dental-related factor, which was dental orofacial trauma, 33%. And the most teeth showed no percussion, palpation, and pain and sinus tract. And the conclusion of this study was the invasive cervical resorption, no difference in sex or age, and the maxillary anterior teeth were most affected in Taiwan's population. Also, traumatic injury, periodontal treatment, and orthodontic treatment were significant predisposing factor. The radiographic examination is important for early diagnosis. These are helpful for diagnosis of invasive cervical resorption and to effective treatment. Thank you.